At some point in March 2020, the province had become an epicenter of COVID-19.
In the beginning, the outbreak response team could not cope with the magnitude of the pandemic, especially at the rate it was spreading. So even when we had to do our first mass screening, the community was not that friendly.
When it happened that we had the first 5 cases, we had to inform the people throughout the province, and they had to be ready on how to respond.
Through the support that we received from the World Health Organization, we were able to gather the resources and make sure that we are well placed to respond positively towards COVID-19.
Whilst we were learning, it was learning by doing. We had to learn what is COVID. We had to learn how to deal with it. We had to learn how to deal with the massive amounts of misinformation, the infodemics at that era.
We were handling a lot of data, a big data, in a very short space of time. So we needed to digest this data or translate it in a way that it can assist us to make a decision. But that capacity, I think it was lacking.
At some stage, we had 25 nurses with COVID at home. We had quite a number of staff members who passed on.
So it was very, very difficult for the district to start, picking up in terms of screening, contact tracing. I think that's where the struggle started.
There was panic because that which people thought was a far distanced global pandemic was now in their own yard.
Oh, their anxiety was great because the uncertainty of what is next. But from the onset, we knew, because of the large population, the way in which our communities live, which are very crowded, etc., we knew the transmission would be high.
I remember even when we had to follow the first person whom we say patient 0, the team we sent, they had to come back. We had to send the second team. The family felt that we were really stigmatizing what they have.
Before we introduced Go Data in the department, what would happen is that all COVID-19 cases were managed centrally. So we had a team of 3 or 4 doctors that were in Bloemfontein, and we expected to do case investigations throughout the entire province. I think as the number of cases grew in the province, it became very clear that our traditional ways were soon going to fail us.
But at the beginning, as it was a new pandemic, we didn't know exactly what to do. We're using the data collection manually.
So we really required an extension level assistance, and that's where really the World Health Organization played an important role, not only in terms of providing us with the infrastructure that was required to roll out Go Data. Infrastructure would mean the tablets, the smartphones, the laptops, the printers, but also fantastic training that was not only focused at the administrators at head office, but also the clinically trained personnel that were in the facilities, in the communities.
There were a lot of intensive training in terms of guidelines, protocols, what to use in which situations, criteria when to go to the next level.
And that's when we really introduced Go Data as the information systems platform. As you can imagine, in the context of introducing a new information system in the middle of a pandemic, it's like putting together a plane mid-air.
Now the role of technology came in handy there.
Prior to introducing electronic systems, we had what in our department we call the pandemic of paper. So we're pretty much very paper-based. Data would be collected using paper-based tools. Those would be aggregated to the sub-districts and then to district and then to province.
We use paper folders, numbering our case, and that job is to us very laborious.
So as you can imagine, the burden causes a delayed reporting time, delayed analysis, delayed response as far as decision making is concerned. Essentially what we started doing was to look at what are the digital tools that are available to the department.
Having the call center facilitated a collective approach.
We were trained by the World Health Organization so that we can know how to do the work. We were going from houses to houses, which is door to door, screening the people inside the households.
We had investigators where we were investigating people, and we had also communities calling in that call center.
The call center, what I want to say, was not just people on the phone. Interventions and decisions were made regarding patients with COVID. There was a briefing from the call center every morning.
So that support really provided the department with an opportunity to begin to analyze COVID-19 data in order to curb the pandemic.
As a result, our infection rate was reduced because we had the root cause analysis.
But what was key for us from WHO was the technical skill that they brought.
We got a lot of support from the WHO regarding how to manage data, how to interpret data, and how to apply that knowledge into the practical space.
I believe that without the support of WHO, we could have lost more lives in the province. So the most important thing is that more lives were saved as a result of the intervention and support of WHO, and we are really grateful of that.